BBC Essex.
A study of family doctors in Essex has found nearly half are at risk of burning out. The research found male doctors and doctors who work in group practices are particularly at risk. Dr. Peter Orton's from Aviation Medica at Stansted Airport and was the lead author on this report. Good evening to you.
Good evening.
We've often heard about junior doctors in hospitals, but this is GPs in family practices, isn't it? What's causing all this?
Yes, it is family doctors, and we looked at all the Essex GPs in the NHS and found half were exhausted and 4 out of 10 were depersonalised, which is worrying. It's some of the highest levels we've seen in this sort of research. What's causing it, I think doctors do an incredibly good job. What we did show was that they were performing well. They were still caring for their patients and their communication skills were good. I think that there's a lot of pressure on GPs. They're dealing out in the community with early onset conditions, a lot of ambiguity with the presentation, but increasing demands on them. Their workload is going up all the time, changes in the healthcare, and also, as well as representing the patients themselves and their interests, they're actually faced with a reduction in resources, and the whole complexity of general practice is taking a lot more on extended roles.
Because the perception was that doctors have got more cash, they work shorter hours, they no longer work out of hours, they're about to take control of the NHS. But despite all that, you're saying there's still a lot of pressure on them.
Yes, there is a lot of pressure. The doctors do spend a lot of time working, not just consultation with their patients, as running the business and the team working. They're often working extra hours beyond the time that you think they've gone home. And all of this is causing additional levels of exhaustion. This is some of the highest levels we've seen using this particular survey tool, which is highly sensitive. And what we're trying to do is raise awareness so that steps can be taken both by doctors themselves, their practices, and the healthcare authorities to try and understand this and to put some processes in place to try and help cope with this.
Now, this study was carried out in Essex. Is there any indication that Essex is any worse than any other area?
No, not at all. What was interesting about the study, this is one of the largest ever done, and it had all 600 GPs in Essex. We got a very high response. Over 70% of family doctors participated. No, we obviously didn't do it in other areas of the country, but we think these are probably fairly typical of other areas. We don't see that Essex GPs are any different.
Does it mean that patients are getting a lesser service?
Well, it's interesting that we measured performance we tape recorded over nearly 800 consultations with their doctors and interviewed some 2,000 patients coming out of their doctor's surgery for general interpersonal skills and care, and that was still maintained. So despite these high levels, doctors are performing on stage, they're still caring. But I have to say that I think that probably some if you talk to doctors themselves, they'll say, well, yes, the job's getting quite difficult. I'm doing my best. Nobody's detecting it, but I'm sure ultimately that it is likely to affect patient care. But I think what's interesting is it may well have an effect on manpower, sickness records, people leaving the profession early, going part-time, and not necessarily being there for the longevity that we've expected before.
The study also found male doctors and doctors in group practices were more likely to be at risk. Is that because they are less likely to be part-time?
Yes, you could argue that female doctors are more likely to be part-time, but females are also more empathetically patient-centred. Just being female, I think there is a male thing. We certainly found the younger females, and I think it takes time for a younger male to get in to develop their coping mechanisms. But the other interesting point you raise about group practices is there are extra demands in group practices. There's less autonomy, less control of work environment, and there's interpersonal tensions within team working. Doctors need to sort of look at developing more effectiveness and also trying to reduce their demands on themselves.
Finally, with all the changes about to happen in the health service or planned for the health service, do you think it will change any time soon, or could it get worse before it gets better?
Well, these are worrying figures. We're seeing quite a high personal distress in GPs. I've been in practice before coming here about 23 years, and this is about the 6th major change in the health service. I think we're heading for more of the same, really, and with a reduction in resources implied, doctors are getting squeezed on their ethical dilemmas and decisions when they're primarily there trying to help their patients. But they do a good job despite the pressures.
Thank you very much for your time this evening. Dr. Peter Orton there from Aviation Medicare at Stansted Airport and the lead author of that report.